Suicide!
Thank you, Town Crier. The Honourable Kim Wilson, JP MP, Minister of Health, event organisers, ladies and gentlemen. It is an honour to welcome you all to City Hall this afternoon as we recognise and commemorate World Mental Health Day, not just here in Bermuda, but across the globe. And I'm honoured that different community partners are joining us in the City of Hamilton to recognise the importance of this day. You know, research shows that 1 in 4 people will have a mental illness at some point in their lives. To bring this into context, this equates to about 15,000 of us here in Bermuda. What I'm about to say, with all the people that are experienced in dealing with this issue, I'm saying this as a lay person. So please, if I enter into anything controversial or whatever, it's with the best intentions. But I feel that the best way to treat a mental illness is to be able to treat it. The stigma that is attached to mental illness is unnecessary and can make the difficulties worse and the road to recovery that much harder. Empathy on our part is key. We need to make it okay to talk about how one feels and how one is thinking. We must make our decisions through education rather than through speculation, so that those in need can reach out and indeed get help. Seeking help should open doors rather than close them. We can support, we can facilitate positive outcomes. So I am encouraged here today by the community coming together and making mental health the focus of today. Thank you again for coming. Welcome to City Hall. And it is now my great privilege to welcome Minister Wilson to the podium. Thank you all.
Good afternoon, and thank you, Mayor Gosling. Today, October 10th, is Mental Health Awareness Day. Today, we focus our attention on mental health, but as many of us know, one day of the year is not sufficient. We need to start seeing every day as Mental Health Awareness Day. While it is important to stop and recognize the international observances, there are things that we can do every day for ourselves and others to promote mental health. The theme for Mental Health Awareness Week 2019 is Mental Health Promotion and Suicide Prevention. The World Health Organization has found that globally, suicide is the principal cause of death among people aged 15 to 29. But it is not something that only impacts young people. Suicide rates amongst individuals 65 years and older are still the highest for both men and women in almost all of the regions in the world. And it is something that we deal with here in Bermuda as well. Although by international comparisons, our suicide rates are among the lowest for high-income countries, based on figures from the Bermuda Hospital Board, over the last 17 years, there have been between 15 and 19 discharges from King Edward per year after an attempted or suspected suicide attempt. And between 2006 and 2015, there were 16 known suicides. These events frequently don't happen out of the blue. And to develop a suicide prevention strategy, we need to look at the opportunities that there exist to intervene. 90% of people who die of suicide have a clinical mental illness, according to the World Health Organization statistics. On inpatient wards, suicide can be prevented by having good observations on the wards, comprehensive staff training, safe staff training levels, encouraging adherence to treatment to be more effectively treat symptoms of mental illness. The Mid-Atlantic Wellness Institute includes an assessment of suicide risk during all new admissions and has developed a crisis safety plan which assists service users to assess support when they need and notice that an emergence of any self-identified warning signs exist. In the community, the World Health Organization found that 75% of people who complete suicide had contact with their GPs in the last 12 months. And more importantly, suicide prevention training for GPs is effective at reducing the risk of future suicides by 50%. One of the continuing medical educational training sessions at Bermuda Hospital Board this week was specifically for community physicians. The topic being suicide prevention in primary care, screening and treatment. BHB also offers a one-day training for businesses wanting to improve employee understanding of mental health. In addition, the MWI staff also respond to requests for awareness presentations and education within our community. Individually, there is more that we can do and must do to support our own mental health and that of our loved ones. One of the World Health Organization's recommendations on suicide prevention is improving mental health literacy in the community so that people can identify mental distress and mental illnesses earlier, helping individuals get more effective help. Warning signs can include verbal signs such as "I can't go on," "nothing matters anymore," or "I'm thinking of ending it all." Take these seriously if you hear them. Becoming depressed or withdrawn. Marked changes in behavior, attitude, or appearance. Getting affairs in order and giving away valued possessions. And suffering a major loss or life change. These may and may not indicate someone is suicidal, but the key highlight is that if you are worried, ask. That can be the opening that someone needs to talk. And know that there is help that you can access. You can speak to your GP. There are employee assistance programs provided by many companies that offer counseling. There are private counseling and psychotherapy services that are also available here in the community. The Mid-Atlantic Wellness Institute offers a wide range of services and therapies. MWI also provides a walk-in service for people in crisis from Monday to Friday, 8 a.m. till 5 p.m., and a mental health crisis line at 239-1111. That can be called around the clock if you are in urgent need of help. So today, if nothing else, start with the simple questions about how are we feeling and managing in our lives. Think about this for yourself and ask someone else in your life, especially someone you may be concerned about. And if the answer is not too good, then take some time to help make a difference. Thank you.
Thank you, Minister Wilson. My name is Preston Swan, and I'm the Vice President of Clinical Operations at MWI. First, I would like to thank and recognize our partners that we have with us today. I'll start from my outside right. We have Jonathan Jarvis, who is representing the Bermuda Councils Association, along with Camille Curry, who is also part of the Bermuda Councils Association. We have Rosina Hartman, is representing the Alpha Nu Omega sorority. We have Shanae Scott, who is our chairperson for the Mental Health Awareness Committee. We have, on my left, we have Chris Gibbons, who is from the support group Losing Someone to Suicide. We have Mr. James McDonald, who is the chairperson of the Bermuda Mental Health Foundation. We have our CEO, Ms. Vanetta Simons, Chief Executive Officer at the Bermuda Hospitals Board, and the Minister I've already thanked. And of course, we are our Mayor who is with us. So thank you everyone for coming. It will take a community effort to increase our understanding and our responses to mental health, how we can reduce discrimination, and help prevent suicides. Every person in Bermuda can be a partner in this effort to improve our mental health here in this island. From the efforts of the Mental Health Awareness Committee, stronger relationships are creating new opportunities for us to spread the word. So the Alpha Nu Omega sorority and fraternity, whose mandate is mental health awareness, have become great partners. They have funded and organized a mental health scavenger hunt at the end of September, and they are sponsoring weekly interviews on Sunday evenings through November on the Strength for the Journey radio show on Hot 107.5. We just started to explore our possibilities even with the Bermuda Football Association. BFA official took the mental health first aid training this month, and as the minister mentioned, well, we talked about it, the Bermuda versus Mexico game, we're going to have a representation right at the game so that we can, as people are coming in, make them aware of mental health, education, and we have a little, we call it a wellness game as a sort of fun activity, again, just to create awareness. I would also like to mention the Bermuda Mental Health Foundation. They will be having the Steps to Mental Health walk this Saturday, so please join in. It starts at MWI at 1 p.m. with a press conference, but the walk will commence at 2 p.m. The Mental Health Foundation has helped to raise funds to support education about mental health and have funded group homes for people recovering from mental illness. This is a great opportunity to get out there and support mental health wellness and make a difference. So in closing, I will repeat the minister's message. Every day, we should be aware of mental health, not just today. It will make a true difference in our lives and in the lives of those who we love and work with. Let's not get stigma get in the way of us seeking help, because no one has to suffer in silence. Thank you.